Hello, my name is Sung Mo, and I'm a second-year FPMRS Fellow at Northwestern University in Chicago, Illinois. Today, I'm proud to present our study titled Prevalence of Pelvic Organ Prolapse Among U.S. Racial Populations, a systematic review and meta-analysis of population-based screening studies. I would like to thank ICS and the entire planning committee for allowing us to present our work. I have nothing to disclose. As the proportion of elderly Americans increases, pelvic organ prolapse surgeries are anticipated to rise nearly 50% by the year 2050. Furthermore, it is also estimated that by 2050, 40% of Americans aged 65 years and older will self-identify as Hispanic Latino, non-Hispanic Black, Asian, American Indian, and Pacific Islander. Understanding prolapse prevalence for all ethnic racial groups is important to anticipate pelvic floor health needs for all women. To date, there has not been any systematic review that examines the prevalence rates of prolapse among diverse racial ethnic populations in the US. Therefore, the aim of this study is to determine the differences in pooled prevalence rates of symptomatic prolapse across different US racial ethnic groups using existing screening-based epidemiologic studies. We conducted a systematic review of literature by screening electronic databases from inception to October 31st, 2019. Studies were included if symptomatic prolapse was diagnosed by either physical exams or questionnaires, if the prevalence rates were determined in non-gynecologic care-seeking settings, and if study outcomes included a sample of U.S. community-dwelling women from more than one racial ethnic groups with prevalence rates reported for each study population. We chose to exclude women presenting to gynecologic care settings and conference abstracts or non-peer review articles. The quality of the included studies were appraised using a stroke checklist. The following data were abstracted from each article. For each racial ethnic group's prevalence rate, we calculated their point estimates and 95% confidence intervals using normal approximation interval. We then used chi-square tests to examine the association between racial ethnic groups and prolapse prevalence for each study. Our initial search yielded 1,261 articles. After eliminating articles that do not meet inclusion criteria, a total of 36 abstracts and 9 full texts were closely reviewed. Ultimately, after reviewing the articles identified during the initial screen, only 5 articles met inclusion criteria. Of the included studies, only 1 study used physical exam findings to diagnose symptomatic prolapse, while the rest ascertained prolapse by self-reported questionnaires. Kudish et al. Utilized Women's Health Initiative's Prolapse Classification System to define symptomatic prolapse as grades 2 and 3, which correspond to prolapse extending to the introitus or outside the vagina respectively. Of the studies that utilized self-reported questionnaires, Brazil et al. Asked participants if they were previously diagnosed with prolapse, while Wu, Rothvet, Whitcomb assessed symptomatic prolapse by asking study participants if they were experiencing prolapse symptoms. Only Whitcomb and Rothvet specified timing of prolapse symptoms ranging from the past 3 to 12 months. 2 of the studies were national surveys, while the others were regional. There was no participant age limit for the national surveys, while the regional surveys included women from 40 to 69 years of age in Northern California and 30 to 79 years of age in Boston. All studies included white, Black, and Hispanic women, while only 2 studies reported prevalence rates for Asian American women. Of all the studies that included Hispanic populations, only Wu subcategorized this population into Mexican Americans versus other Hispanics. In terms of prevalence differences, prolapse prevalence rates determined by physical exams were higher than those by self-reported questionnaires across all racial groups. When comparing prolapse prevalence rates within each study, 4 of the 5 studies demonstrated statistically significant differences in prolapse prevalence across racial ethnic groups. Finally, we determined the overall pooled prolapse prevalence rates from all included studies for each distinct racial or ethnic groups. White women 10.76%, Hispanic women 6.55%, Black women 3.80%, and Asian American women 3.40%. A significant difference in pooled prevalence rates among these 4 racial ethnic groups was also noted. In conclusion, our study found that while white women had the highest pooled prolapse prevalence rates among all available racial ethnic groups, Hispanic women experienced the highest rates when compared to the other minority women. Additionally, there was no prolapse prevalence data on women of Native American and Pacific Island descent. This information is imperative to anticipate pelvic health needs of the increasingly diverse and aging woman population living in the US. Here are our references. Thank you again for the opportunity to present this work, and I will be happy to answer any question.